We know that COVID-19 has had a huge impact on long-term care facilities, but a new report to the government highlights some action that can be taken to prevent future tragedies here in Alberta. Now, some of it will start right away. That's things like no longer having ward rooms where more than 2 people are staying together. Those will be phased out. Also looking at keeping couples together and allowing family caregivers. But other factors we've heard about a lot during the pandemic, things like staffing concerns, having no uniform approach to sick leave, or the majority of staff being part-time, meaning they have to work multiple jobs at different sites. The government says they don't have answers for that yet.
There is a recommendation as well that we move and transition to private only, and so we'll be looking at that. That's not something that's going to be moving right away, but transitioning those 50 ward rooms into just being semi-private going forward is probably very significant.
The report is over 200 pages and makes dozens of recommendations and was only given to reporters minutes before tasked with asking questions, which is unusual and led to Minister Shandro taking a second round of questions over the phone in the afternoon about how this will proceed.
A big part of it is going to be we need more beds in the system, but there's also opportunities in changing the portion of people who get care in their home rather than facility-based.
This comes as the opposition NDP shares the stories of families concerned long-term care facilities won't be held accountable for deaths related to COVID. The province is debating Bill 70 that would create a higher legal threshold for families to sue these centres for negligence.
So many facilities manage to get it right, so why are we trying to prevent a small portion of these places from being held accountable? This isn't whether it's negligence or gross negligence, but the responsibility we all have to hold people in places accountable for their behavior.
If passed, Bill 70 would be retroactive to the beginning of the pandemic and would mean there's no liability for facilities and employers as long as all COVID-19 government orders were followed. The government arguing this is necessary to provide stability in our healthcare system and is similar to protection in other provinces. In Edmonton, Carly Robinson, City News.